Well, hello. I am Linda Berthier, and I'm here with some beautiful people, and we're going to be speaking about nurse midwives. Now, as you know, or you may not know, nursing has a century of history behind it. As far back as the Nightingale era, where Florence Nightingale was actually noted as the first nurse to ever exist, to practice nursing, and to pioneer what nursing is today. She was a mover and shaker within society. And then we went into the Athens era, where we became midwives, the first midwife, Angiodice. She actually disguised herself as a man to learn how to be a midwife among doctors. And today we have very proud, strong women who are here to advocate and talk about what midwives have become. So we will be discovering answers to some of your questions and even sensitizing you on more information that you may want to know about the past, the present, and the future of midwifery in St. Lucia and in our region. So welcome. Welcome, Nurse Marilyn Paul. She is a midwife. She's a nurse and a midwife with experience under her belt of 44 years, Chief Nursing Officer, past President of the St. Lucia Nurses Association, and she's going to give us some serious nuggets about nursing and midwifery. Welcome, nurse.
Thank you.
We also have another nurse sitting next to her, Amber. She's going to be all smiles because Amber Antoine comes with 8 years of nursing experience, and today she is actually qualified, certified today as a midwife. So we're celebrating with her. Congratulations, Amber. Next to Amber, we have Julian John Stephen. She comes with 6 years in nursing, and out of those 6 years, she has 5 years as a midwife. You may see her smiling face on the obstetric unit at OKEU. So welcome, Julian. And last but definitely not least, on our panelists, we have Ms. Diana Henry Ernest, who has 33 years experience in nursing with 24 years within that as a midwife. She is qualified to not just be a midwife, but to be an educator due to her bachelor's in public health and a master's in midwifery. She has an exemplary history that we would love for you to get to know today. So let me say a special welcome to my panelists. How are you guys doing? So I'm going to ask Nurse Paul, right? She's ready and she looks ready to answer my question. So we'll go right into the past. Now you heard what I said earlier about the Nightingale era and how far nursing has been and how far we've come. Based on your understanding of midwifery, has midwifery evolved in St. Lucia over the past few decades? And what are some of the significant changes that you can share with us within our practices and our policies?
In St. Lucia, midwifery evolved from its historical context. And midwifery is an age-old, an ancient profession. And it dates back to the time of Jesus, to the time of biblical times, where the actual definition conceptualized what midwifery was, being with women. At this time, women used to stay with one who was laboring and to really support them in providing comfort and coaching them through labor and delivery. But despite that, midwifery did not just remain as a cultural and tradition. It moved to a modern professionalized profession, and it's now an independent profession. But the historical concept is very, very important and very interesting to know. When Europeans invaded our little St. Lucia and the Africans came as slaves, the Africans women were really the ones providing the traditional midwifery care to society. They even delivered the babies of the white slave masters' wives. So this history really enables us to know that we can grow from strength to strength in this practice. So the traditional midwifery practice that evolved from the African slaves, it stayed with us in St. Lucia and in most of the Caribbean countries. And during this time, as you can well imagine, the road networks were not good. There were not many hospitals or healthcare centers. So people did deliveries at homes and in communities, mostly at homes. And so the traditional practice continued in St. Lucia until the early 40s. We used to hear about the famshai in St. Lucia. Even I was one of those the famshai delivered, my mother told me. And the famshai was the one in our communities culturally known to be the midwife. And she would be going to the various homes, always on call for babies who were born and so forth. And her knowledge was limited. Her skill was limited, but her presence, her compassion was there. So our involvement is really very important as a profession because knowledge increased when training started, formal training started in the 60s for St. Lucia. And this was done because we were colonized by England. We had the opportunity, some nurses had the opportunity to travel there to learn the profession, which was taught mainly by obstetricians. And they came back home to train others who were here. Now, in this time, you had to be a nurse to become a midwife. You had to be able to read and write and knows the aspects of health that a general nurse would know. And it's here even now that you must be a nurse and then become a midwife. But that is beginning to change. But it sets a base, and then every nurse had to become a midwife. Because at any time, you would be called to serve in communities, and you had to have the skills of midwifery for you to serve in the community. When we look at the community nurses in the 60s, when the health centers were built in the local communities, the midwife was queen in her community. She was the most respected member of the community.
And she used to actually live in the health center at the time, right?
Every health center had a nurse's quarters where the midwife lived with her family. And she's on call 24/7.
I grew up in Babono, and I knew of the nurse who lived there. And regardless of the time of day, the nurse would be available. Poor job, I would say, because sometimes they would knock at the oddest hour to seek help during emergencies. And this is a snippet of what nurses have gone through, how we have evolved. We'll be right back to talk more about midwives, critical in every crisis, as our theme says for International Day of the Midwife, coming later in the early part of May. So we'll be right back after these messages.
The Substance Abuse Advisory Council Secretariat, within the Ministry of Health and in collaboration with the Ministry of Education, will be conducting the 5th round of the Global Youth Tobacco Survey, GYTS. This survey is to gain information on patterns of tobacco use, exposure to tobacco products, and their related health risks. The information received will help review and develop programs for youth to protect against the dangers of tobacco. The survey will be done within all secondary schools on island with students in grades 8, 9, and 10. Participation in the survey is anonymous and confidential. The Global Youth Tobacco Survey is scheduled from April 30th to May 9th, 2025, and will not only track youth tobacco use trends, but will also empower youth awareness, advocacy, and help reduce future tobacco-related diseases. For more information, please contact the Substance Abuse Advisory Council Secretariat at 468-7921 or 468-7919.
Welcome back. We're here with midwives. We are here to sensitize you, St. Lucia, about nurse midwives. Midwives touch lives, as you could see from our table advertising here. We are going to be celebrating International Day of the Midwives coming 5th of May. And our theme for this year is midwives, critical in every crisis. So Nurse Paul, who is a registered midwife, she's retired, but she's still here to give us the golden nuggets of midwifery. You may see her sometimes at Planned Parenthood. You're still there?
No.
Where are you now?
I'm with clinical supervision with Sir Arthur Lewis.
Awesome. I love to
Mostly.
hear that. So we're passing on the knowledge, which is important in St. Lucia because we tend to lack succession planning. So this is an example of succession planning. Now, Nurse Paul, you were telling us about the past, the midwives in the communities and how nurses used to stay in their quarters in the health centers. That's how far we've come. You managed to answer quite a few other questions I had for you. One question I have for you, though, is what was the training process like for midwives during that time? And how does it differ to today's requirements as you are in it in the clinical setting as an instructor?
Good. The training was over a year, but it was more intense in clinical practice. We learned on the job, and we had lectures in between, mostly by the senior obstetricians in the hospitals. But it was basically and more intensely hands-on in midwifery practice. So the skill played a very much bigger role in this time. But now in our practice, we want to balance it a little bit more. Knowledge, advanced knowledge, is taken over from the intense skill. It's been balanced, but the one component that we never miss is the attitude component, the caring component. As I said before, that's what makes us competent midwives. So knowledge is increasing, technology is increasing in our time, but our attitudes, our caring attitude, our compassion remains the same. So it was a dichotomy between knowledge and skill in the past, but our competence relied on our compassion and care. It's more knowledge-based now, but nonetheless, we are still competent in what we do.
I appreciate that, and that's some serious knowledge that you're sharing with us. I'm so pleased that you are on our panel. So I'm going to move over to another panelist all the way to the end, but she comes with a lot of experience, which Nurse Paul has already made reference to, but she is a mover and shaker in midwifery education. Diana, I have a special question for you. Based on what Nurse Paul just shared with us, what are the biggest challenges facing midwives in St. Lucia today as it pertains to knowledge, development, scope in St. Lucia?
As it pertains to knowledge development scope, based from where we came from, when midwives were being trained at the hospitals, right now midwives are trained at the school. And of course, you have to be a nurse practicing for a year before you can apply to become a midwife. And of course, the school is responsible for empowering the students with the skills, the knowledge, and the professional behavior that is required for them to become midwives. So if we have persons who are empowered with the knowledge, skills, and behavior to pass on that skill set to the pupil midwives at the college. So it's a 3-year it's a 18 months program, and at the end, our pupil midwives leave Sir Arthur Lewis Community College with a diploma.
Regarding the challenges with education, self-development, the need to go into Sir Arthur Lewis to develop yourself further into that specialty area as a midwife, then going into the healthcare setting, whether it be in the community or the hospital, how do you think it has affected, whether negatively or positively, the maternal outcomes?
I think the outcome for the mother and her baby is awesome because of the training that we get. It's 50% practical and 50% theory. So having that balance, I think the outcome is positive and there isn't a negative impact so much. However, the challenge that the pupil midwives face is that they have to work and go to school. That's a major challenge that we face. They work full-time and they are at school full-time. So you find that they're mentally fatigued, and when they go out there, they come back and they report that they are so fatigued they cannot study. They are not able to assimilate what they want to at the level that they want to because of the stress that they are feeling as it relates to going to school and being a full-time employee at wherever they're working, hospital, wellness center, or wherever they're working. So it's a challenge for them. And of course, they are not able to assimilate the skills that they require comfortably. They struggle through it.
Wow. I was looking at it and saying 50% practical, 50% theory, which is a plus, but you just highlighted that it still is a challenge because they are full-time nurses still working. So we're hoping that one day we will get the nurses to get leave, study leave, to be able to concentrate on that, because without midwifery, without delivery of healthy babies, our nation will not multiply. Our population will be affected, right, Nurse Paul? So I'm hoping that you would be one of those to advocate for that continually until we get it, because as a midwife, I was one of the privileged groups to get study leave. So they would put us on the schedule, but we'd work maybe 2 days in a week at the hospital setting, and 3 days we'd be allowed to go to school. So I'm hoping that this is reintegrated into studying, because what you explained there, I could tell it must be challenging. How do you learn when you're so tired straight from a shift, right? I'm going to ask a question to a nurse midwife, where most of her nursing experience, she has been a midwife. Out of 6 years, 5 years a midwife, right, Jillian?
So I've been a nurse for 11 years, and out of that 11 years, I've been practicing as a midwife for 5 years.
Okay, so we clarified that from her bio. It's 11 years in all,
Yes.
5 years as a nurse.
As a midwife.
As a midwife, and 6 years.
As
So
a
you
nurse.
were a full-time nurse, registered, working, and then you went to specialize in midwifery.
Correct.
Excellent. So in your midwifery experience, as Nurse Diana Henry just explained, where it's 50% practical, 50% theory, you had an experience not just only in the hospital settings, but also in the community settings. Yes?
Yes.
So you were able to work side by side with our experience practicing midwives who were in the community health centers. We say health centers, but the term now is the wellness centers.
Mm-hmm.
So you got your internship experience. In your view, from what you've observed and what you've been taught and coached by the midwives, what is your view of the role of the midwife in the community when it comes to community health education?
Well, to add on what you said about me, I actually spent some time working as a midwife in the community. So I spent a few months in the community after I got my license as a midwife. So in the community, the patient or the mother, that's the first point of contact for that patient. In terms of that's where they would get the antenatal care. And then there is a lot of health education being done. The mother is educated on what to expect during the pregnancy. If she's having any challenges, the midwife is educated to help assist in those challenges in terms of, I can say, if the mother is experiencing heartburns, as midwives, we're educated to help her with the heartburns. We also give education as a group. Education is not only given on a one-to-one basis, but it's given on as a group setting where mothers on antenatal days, they would get education, what to expect while they're going through the pregnancy, what to expect when they're going into the hospital to deliver, and even after. We give education on breastfeeding. There's also outreach programs that's being done. Yes.
And I love that you said you do it in a group setting. So mothers are there and they're able to basically support each other, like their own informal peer counselors. Because you're talking about breastfeeding. One thing I noticed while working on the obstetrics unit, which is maternity, is that you can tell the difference, sorry to say, but you can tell the difference between the client who was coached by a nurse at the health centers and the client who sought private care. because the nurses, you provide a lot of education.
Correct.
We may not have our organized Lamaze classes like we used to. I know there was a Lamaze unit in Granivier some years ago, and I'd love for that to come back. I'm advocating for you midwives to consider putting that together. But when the mothers are fully prepared in knowing what to expect, by the time you say, okay, you are 5 centimeters, I just want you to breathe, you could see them doing it, and they ask you questions that are exactly relevant to the present moment during their pain. And they're better able to imagine what's happening now, because you do a fantastic job in the wellness centers in the images that you give the mothers, showing them the different sizes, the centimeters. So when you say 2 centimeters, then they know, okay, God, give me strength because the time to push is coming close, right?
Right. And now being at the hospital, you see those mothers, they come more prepared in terms of education-wise, in terms of what they should do at different stages of the labor, and in terms of when they have to go into the labor and delivery room, their bags are already prepared, vis-a-vis those who only did private care during the antenatal period. Then at this point now, you as the nurse midwife have to educate them as to what they need to bring into the labor and delivery room.
Okay, so we're definitely not knocking down private care, but we want to encourage the education everywhere a client is. So whether you go to a private doctor or nurse, or you go to the community, we want to advocate for our midwives and our obstetric practitioners to educate more, because as you can tell, you're hearing that the education makes a big difference in preparing the mother for delivery. Nurse Juliet, I have one more question for you, if you don't mind.
Sure.
How can the community and the government better support you as a midwife in your work today?
So, like Nurse Henry said previously, for nurses to study to become midwives, we have to work full-time and study full-time. Or if you want to further your education as a midwife, you would still have to do that on your own time. So in recognition, maybe we can get a stipend, or we can get study leave, where we can study full-time and not have to bear the burden of having to work full-time as well. Recognition for midwives as well, because Day of the Midwife is coming up, and we want some recognition as well, not only for nurses, but for midwives on that day as well.
Thank you so much, Nurse Gillian. And there you hear it from the horse's mouth. Don't take it literally, from the nurse's mouth. We will be right back with more information. As you know, we spoke about the past when Nurse Paul gave us golden nuggets about where we've come from. We're speaking to the younger nurses who are speaking about the present, and we will soon go into the future. Don't go anywhere. We'll be right back.
Vaccines work. If a child is unwell, a child should not get a vaccine.
Vaccines are medicines, and medicines undergo stringent testing protocols before they are placed on the market.
Once you fall below 80% and 70%, your population is now at risk for diseases that you had never seen before.
And the countries that have a high level of zero dose have unhealthy children.
Welcome to Shielded for Life, the power of immunization.
Welcome back to our in-depth conversation with 4 esteemed midwives as we look at the celebration of midwives on International Midwife Day, which is annual on May 5th. We're reminding you that midwives save lives. So we were chatting with Jillian, and she was giving us some information about her experience and what midwifery means to you as it pertains to the licensing of nurses and the licensing of midwives as a specialty area. Tell us a little bit about that.
So as nurses, we require a license. However, as midwives, we require a separate license. So as nurses, we have an exam to do, And also midwives have a separate exam to be qualified midwives and to practice as midwives in St. Lucia. Therefore, for additional recognition, we would like that our license be recognized and for us to be on a different salary base from regular nurses.
I totally understand because it's a specialty area.
Correct.
The general nurse who is registered as a general nurse, she's not necessarily qualified or licensed to practice or trained specifically to practice as a midwife, which is to deliver babies and to educate pregnant mothers. Am I right?
Correct.
Okay, so I understand what you're saying, and that ties into our policy development of midwifery, don't you think?
I certainly think
Hint
so.
to our ministers who may be listening right now, our policymakers, our stakeholders, our advocates. So I know we have someone who has a burning addition to that question, to that conversation. Amber, what do you want to add to that point?
So basically, she touched on what I would like to see happen with midwives, or how can midwives be assisted in the future. Like she mentioned, adequate recognition and compensation would be really nice to encourage more people to want to become midwives. Secondly, scholarships and probably financial aid or steady leave with pay or without pay, just to reduce the burden of our future midwives.
And that would help us evolve as midwives,
Definitely.
and be recognized. The whole word is recognition. Now, as it pertains to technology, if you realize she has her tablet, right? This is
That's
where
right.
this is where we're going, the future of nursing and midwifery. So how do you see technology impacting midwifery practice in the future?
Right. So technology will increasingly reshape midwifery practice and offer enhanced patient care, improved communication, and expanded access to care, especially in underdeserved areas. This includes the use of electronic health records, remote patient monitoring, and digital health tools like telemedicine and mobile apps. For example, as Nurse Paul mentioned, the midwife of the community, she's in the community, and it would be easier if she had some platform or some form of technological device to monitor our patients for early detection, for better guidance, to have a better outcome of our pregnant women out there.
And I appreciate that you mentioned the health information system, because I could stay in my office at the Ministry of Health and access the client's records. Of course, we have codes that allows one person that particular access based on your level, and I'm able to see the documentation on a client. So when I get this call about a mother who is diagnosed with an issue that can be cured or needs counseling, I could access the information via information, but it's really private. It's not open to everybody at the ministry. It is a code given to a specific person who is licensed and appointed to take care of you, midwife. So mother. So don't be worried. Your information is private.
Very.
But I appreciate how we have advanced in our midwifery career and the goals of midwifery. When it comes to collaboration, Diana, I have a question I want to ask. How can midwives collaborate with other healthcare professionals to improve maternal and child healthcare in the future? I touched on a little bit on that as a PMTCT coordinator, prevention of mother-to-child transmission of infections during pregnancy. But what collaborative efforts can we envision and look towards?
Okay, so midwifery is an autonomous profession. You work on your own, but that does not mean that you cannot collaborate with the other healthcare professionals. So therefore, a midwife is caring for her clients at the wellness center. She has a normal client, no issues. She will continue caring for this client until this client is ready to have a baby and to move to the hospital, the secondary care for her birth and delivery. However, if during that course of her caring for this client has a complication, she must, and I cannot overemphasize this, she must refer this client to the necessary practitioner. So, if you realize this client needs a simple thing like nutritional care, you refer or you collaborate with the nutritionist, as well as the gynecologist. if the client has an issue. So even if we talk about midwife or midwifery as being an autonomous profession, we collaborate with whoever the client needs so that the holistic aspect of this client can be cared for. So collaboration, we do that very well by referring our clients to whoever the healthcare practitioner is.
Lovely. I appreciate that you tied that into the referral process, because if you do not come to the health center, you would not know that we can refer you to Ministry of Equity for those who are impoverished and unable to supply milk to their children. We also have other references that if you need dental help as a pregnant mother, there's reference for that. Dermatological help when it comes to skincare, we have references for that. And it's a smooth process where the midwife would write on a referral card, your business is protected and sent to that through you to the medical practitioner in that specialty area. So collaboration is really important. Thank you so much for clarifying that. Any last words from our panel?
Yes, just to add on the future in St. Lucia, I'd like to touch a little bit about the expansion of research in St. Lucia. Actually, I did a research for my studies looking at the perspectives the society have and the professionals about mills, introductions of mills in the midwifery practice in St. Lucia. Very interesting to note that the society accept mills, and we now have to think in the future how we will introduce mills in our training programs.
That's a food for thought. Anybody else wants to share something?
So as a future midwife or our upcoming midwives, it would be nice to expand on our scope of practice, where you could be a midwife / neonatal care nurse, or you could be a doula. Start back our Lamaze classes to educate the public effectively. And most importantly, it would be nice if we have midwives trained in radiology so we could perform ultrasounds at the health centers and at the hospitals.
So that would also be sonography.
Sonography,
yeah?
sorry, yeah.
Nice, okay. Anything else?
No, thanks.
All right, so Ms. Diana?
Currently, we allow one support person to be present during the labor and delivery of women. So I'm encouraging the public to come support your family or your partner, be present during the labor, because it's a once-in-a-lifetime experience. It's a great experience.
How nursing has evolved, because before at Victoria Hospital, the rooms were so tiny and the doors were wide open between mothers who are delivering, so you could not have families there. But now you have a secure room where each mother has her privacy during delivery. That is an evolving career, an evolving experience for St. Lucia. Ms. Diana, thank you, Gillian, for that point. Yes, Diana?
For midwifery to advance in St. Lucia, we need somebody who is empowered enough to speak on behalf of midwives at the Ministry of Health. We have a CNO who is empowered. She is a midwife and also a nurse. But it would be best for us to have a midwife to speak about what is affecting midwives, sit at the table when the policies are being developed, because you are concentrating on the speciality. Midwifery is a specialty. In the world, wherever you go, in the Caribbean as well, you will find a midwifery officer in the Ministry of Health speaking on behalf of midwives, ensuring that their issues are taken into consideration. So I would really want to see that happen in St. Lucia. And of course, we want midwifery to be recognized as a profession. So persons will be able to differentiate between nurses and midwives. In St. Lucia, everybody is a nurse. But we have midwives and nurses, two different professions. An autonomous profession where we collaborate with other healthcare professionals, but it's a profession on its own. So we call each other midwife Solomon, midwife Henry. This is how we want it to be. I so want that for St. Lucia, because the world is already moving in that direction, people. So in St. Lucia, we need to do the very same thing, but we need it to be coined from policy. and we need it to be driven there so it can be recognized. Midwives will feel valued for the job that they do, because we actually perform magic as midwives. Everybody knows that.
We actually perform magic. The midwife, critical in every crisis. This is our theme for Nurse Celebration of the Midwife internationally this year. So I am Linda Berthier. It has been a pleasure to be speaking with our panelists today about midwives and how they touch lives. We spoke about the past, the present, and the future. And I need to raise this significant point about the changes in policy and regulations that will evolve and regulate and advance midwifery in St. Lucia. This will improve maternal health and child health, and a country who is healthy is wealthy. Thank you for your time, and I look forward to having this conversation again at some point.